welcome you all to the Using Data to Help People Impacted Most by COVID session. Um, I am going to begin by introducing myself. I'm Justin Hollis. I am a research scientist with Wilder Research, and I work on the Minnesota Compass project. Some of my areas of expertise include demography, data science, policy analysis, and program evaluation. And you're also going to hear today from Rebecca. Rebecca, would you like to take a moment and introduce yourself?
Sure, great. Thanks, Justin. So my name is Rebecca Mino. I'm the manager of applied research at Second Harvest Heartland. And I get the awesome job of working with both our internal teams and our program partners to work on evaluation, research, and really just helping our organization use the information we have around us to learn and do better. And I'm really excited to be here today. So thanks for having me.
Excellent. Thank you so much. And now we'd like all of you to take a moment to use the chat to introduce yourselves. We're really excited to have you all join us. And so it's right in the chat. Why don't you put your name, your role in the organization that you're with, and maybe a little bit about what brings you here today. We'll spend a few minutes as other folks join and get settled and learn a little bit about each other in the chat. And just as a reminder throughout, should you have questions, feel free to place those in the chat. We do have some help monitoring that conversation. And so, if you at any time have a question, you don't feel like you can't sort of throw it in the chat, and we'll do our best to address it. Great, thank you. Great, so I'm seeing some folks in the chat. Ala, Catherine, thank you for joining us. Sarah, we've got the Dakota County Libraries. Great to have you here, Sarah. Hi, Kristen, Angie, Bernadette, welcome. So with that, I'm going to go ahead and get started. I'll talk a little bit. Let me talk just a little bit about Wilder Research. We operate as an independent research unit of the Amherst H. Wilder Foundation. And we're one of the nation's largest nonprofit and evaluation groups, and we work with nonprofits, foundations, and government entities to help inform decisions and improve lives. We help organizations measure and improve their effectiveness. We help them identify their needs and solutions and make data-informed decisions to improve the lives of families, children, and communities. So that's what Wilder Research is all about. And our work falls into two sort of major buckets. One of those is the research of the effectiveness of programs, services, policies, interventions of various sorts. So we're really interested in helping our client partners understand the extent to which they are accomplishing their goals, their vision, and their mission. The other really sort of large bucket of work is research on community trends and quality of life. And so basically being in the business of providing data to information on the conditions and the needs that communities have. And Minnesota Compass sort of falls into this second bucket. Minnesota Compass, we really think that we are positioned to help build stronger communities, and we do this by understanding the trends so that we can help communities plan, by making sure to have representation from all parts of our state, by shaping policies for the greatest reach and impact. And we really hope to help maintain an informed public. So anyone can go to mncompass.org at any time. There's no subscription, no sign in, no login. And find the information that they need to help characterize conditions and needs in their communities. How do we do this? We do this by providing credible, nonpartisan, easy to access data and information about the places that we live, work, learn, worship, and play. We also do this by tracking trends and measuring progress on issues that are really about our shared quality of life. We also do this by identifying disparities by including trend data by race, age, gender, and income. And we do this by providing some additional resources for addressing issues. And so you'll find we maintain several directories. We have a directory for leadership programs, a directory for racial equity resources, and we are in the business of making sure that you can take the information that you find on Minnesota Compass that step further into taking effective action. We really are a collaborative project. And so a number of years ago, leaders from these organizations came together and really decided that, not only they, but their peer organizations and foundations really needed a sort of a repository, a common base of information to make decisions with. And so we owe so much of our work to our partnership with these organizations and their leaders through governance, steering, and topic advisory committees. And so all of the data that you find on Minnesota Compass is a product of this really strong, long-standing collaboration. Thank you. As I mentioned, Minnesota Compass is a social indicators project, and we curate data and information on a number of different topics, as shown here, and for all of the communities across our state. But as we all know, COVID really came in and sort of made us rethink what we were doing in terms of all of what I just talked about in terms of tracking trends and understanding data. So we very quickly made the kinds of adjustments that we've all been making to address this the best that we can. So here's what we're going to do today. Basically, in introductions, we can check that first one off the list. And then what I know many of you came for, data and numbers. And so we're going to get into the data and numbers. And I think now is a very interesting time to take a look back over our shoulders to see what has happened and think about where we're going. And I'll try to do that through kind of three interrelated lenses. I'll talk about the workplace, at home, and in communities. And then I'll pass it off to our partner, Rebecca Mino, who can really talk to how a direct service organization uses data to have impacts. And so you'll hear from her. And from there, we'll go into a breakout session where we really encourage you to share a little more about what it is that you're seeing from where you're sitting and what ways you think data and information might help to transform the way that we deliver services to communities and families. After that, we'll regroup to share back a little bit what we learned in our breakouts, and then we'll wrap up. So that's how the afternoon will proceed. I'm very grateful that you all had a chance to join us, and with that, let's dive in. Data and numbers, right? COVID certainly had an impact on those of us who live in the world of data. But I also want to make sure that we're taking the time to think about the ways that it sort of impacted our lives. So the pandemic gave us an opportunity to track data, daily, and you can see here with the positivity right along the bottom, a series of peaks and valleys, many of which were driven by some variant or another. But now we're at this really interesting point, right, where there's a very, sort of steep decline in hospitalizations and infections. And, much of this is, why we see here we've got Dr. Fauci looking very measured. And on Monday, he was interviewed by Judy Woodruff on PBS NewsHour. And well, these are words that he said. We're certainly right now in this country out of the pandemic phase. And so I thought that was particularly poignant because when we planned this event, I wasn't certain whether, is this going to be a retrospective or, it's certainly not over. This is something else that Dr. Fauci said. Of course, that first part was conditioned on a lot of different caveats, but he's right. When you look at the global situation, the pandemic is certainly still ongoing. And, as members of the global community, Minnesota, and we should certainly sort of be aware of that. So the lenses that I'm going to talk about really have to do with workers and employers, families and children, and resilience and stability. So workers and employers, certainly this aspect of our lives was impacted and, in many ways is continuing to be impacted by the pandemic. And so I'll talk a little bit about the ways that we measured and tracked trends there. Right now we're in a virtual space and meeting remotely, and many of us had hoped that we would sort of be coming back into common spaces by now, and so but we're going to have to change the way that we do things. I think more generally moving forward, right? And then at home, families and children, we certainly had a paradigm shift in the ways that we think about the work-life balance and how we sort of, prioritize and meet the needs of, the very, very young and the very, very old in our community. So, parents who are out there learned a little bit about remote learning, and employers out there in turn learned to have a little bit of additional flexibility for the families that are involved with their organizations. So, obviously it had an impact on the ways that we get together with our families. And I think that it's very important for us to keep in mind that although I'll be talking through data and numbers, and that it really is about how people were impacted and continue to be. And then resilience and stability. So this is really about taking a broader step back to think about what the impact of the pandemic has been and how we can use data to help. Specifically, I'm thinking about things like housing stability and food security or insecurity. I know that those of us who have been to the grocery store recently have noticed empty shelves, and I think that there's been a lot of change in the ways that we are interacting in the world. And so I hope that today's event helps to shed a little bit of light on that with data and information. So workers and employers, how were workers and employers impacted? I've got highlighted here, this is the Great Recession, that bump there. Of course, this was an unprecedented, never before since the Great Depression, disruption to the labor market. But then over time, things sort of became stable. And then, you can see sort of in comparison how much more disruptive on orders of magnitude this global pandemic was to the labor market. Largely back in a sort of pre-pandemic recovered labor market, but we all know that so much has changed that not everyone has experienced that economic bounce back. If we look at the industries that were most impacted. We can, think about, the workers and employers in these spaces who have had their livelihoods, inalterably interrupted as a result of the pandemic, and are, constantly, I think we're finally getting our footing and realizing there's, new ways of doing things, and we have to be adaptable to that. If we compare sort of change from, pre-pandemic to post-pandemic, we can see that, a lot of those what were deemed as essential industries early on in the pandemic also saw the biggest brunt in terms of impacts for the folks who work for a living and who rely on income from employment. And here, just in terms of overall job volatility, not all industries experience the same level of volatility at the same time. Many of the spikes and valleys you see here, like with the test results earlier, are driven by variance in, our overall sort of response to different waves of this pandemic. Unemployment insurance is also something that, reached unprecedented levels, and not everyone in the labor market was impacted proportionally, right? And so we can see here over the course of, the sort of 2 years encompassing, much of the worst of the pandemic, that Black workers suffered unemployment insurance claims at far higher rates than other workers in our state. Before the pandemic, we were having, I think, a really important discussion about a worker shortage in Minnesota. And then, of course, we had this great disruption. But now we've returned to this worker shortage, this area where there are more job vacancies than there are available workers. And so this is a problem, I guess, that has come roaring back to the forefront as we sort of think about what the new normal is in terms of relationships between workers and their work. So, at last look, quarter two of 2021, we had 107,990, unemployed workers, folks who are, expressed that they are ready to go to work, and all to fill 714 job openings. And so far more openings than there are available workers to fill them. And this was a problem before the pandemic. Now this problem is back, and we really do have to think critically about how we're going to address it together. Put another way, there's only one available worker for nearly every two job openings in our labor market. And so really rethinking the ways that we define these relationships between employers and their employees, and figuring out a way to make sure that we can ensure our shared economic prosperity moving forward. So now I'm going to talk a little bit about the impacts of the pandemic through this family and children lens. All of the workers that we just talked about from the various industries and backgrounds, they all go home to neighborhoods and communities and households, right? And so thinking about the ways that the pandemic has bled over into this aspect of our lives is really important. So Minnesota ranks relatively high on the list of states that have school-age children for whom both parents are working. This cuts both ways, right? On the one hand, it means that maybe there are many states that aren't doing as well in terms of having both school-age children's parents in the job market. On the other hand, when we talk about the kind of job loss that I just showed evidence of, and I think particularly in some of those industries, you can see how families with children might have been disproportionately impacted. And of course, childcare, high quality childcare is a scarce resource, and here we can see, by the different ways that COVID impacted their work, what percentage of families with children under 12 had difficulty securing high quality childcare. And so this was a question from the Census Bureau's Household Pulse Survey, and these results were robust enough to report on for the state of Minnesota. And then in terms of, just our overall well-being, people experiencing depression or anxiety symptoms was certainly at a heightened level. And, these are the most recent releases from the Household Pulse Survey. You can see just, as early as just a few weeks ago, nearly, a third of households with children have, are suffering with depression and anxiety associated with the pandemic. So these are areas that direct service organizations, foundations, programs, and services are really focused on, right? These are the places that we can measure the extent of our impact over time. And I think that we're definitely having an impact, but of course, we want these numbers to be as low as they can possibly be. And then in terms of education, so how were young children impacted by the pandemic? Well, it certainly wasn't a positive experience for education overall, at least as evidenced by students achieving reading standards. And then when we break this out by income, we can see there's even a more kind of egregious disparity for lower income students. And so I think that this really points to the fact that income had a big role in sort of insulating families and communities from some impacts. And that's an important, I think, thing to think about as we move forward. And then achieving math standards. Again, this is, you can see overall that the pandemic did not have an overall positive effect on this, and that we weren't even able to test in one of the years. Similarly, when we break this out by income, we can see that lower income students disproportionately impacted by the pandemic in terms of achieving the math standards that are set out in the NCAs. So, what does all this mean at a community level in terms of overall resilience and stability? How did we fare? How are we faring? And what lessons did we learn that can help us moving forward? So in terms of housing security, renters, I think, certainly experienced increased vulnerability. And here we can look at the percentage of renters who reported that they were experiencing some housing insecurity. And so, overall, the state faring slightly better than the nation, but you can see that there was a lot of uncertainty early on in the pandemic, I think is evidenced by some of the volatility in this trend. And then when we break this out by race, we can see that there's a, a really startling disparity in an apparently growing gap for households, renters of color experiencing housing insecurity. And this is very recent, right? So you can see that up through the 11th, we've got data from this survey indicating that over 40% of renters of color in Minnesota are experiencing housing insecurity. And so I think that having this data readily available to organizations that provide support services in this area is really, really important. And then the impacts on small business. So I talked early on about the impact on workers and employers sort of more broadly, but generally we can see a trend, a lot of instability with regard to, when folks think that things would return to a quote unquote normal level of operation, right? And I think that many businesses have to rethink what that meant over the course of the pandemic. I think that this one piece of relatively positive news came, was really, I thought, interesting to me that, overall, this is trending upward. The percentage of small businesses that really have said that they've, made the adjustments, they've adapted, and that, the business cycle has sort of returned to a normal level of operation for them. So I thought that, on a topic where there's not a lot of positive news, that this was maybe a little bit.
Justin, we have a question about housing. Amanda asks, do Metro Twin Cities follow the general Minnesota trend in housing?
Yeah, that's an interesting question. I think yes and no. In many ways, the Twin Cities drives what the overall sort of statewide trends, what they would be. So it kind of depends on your point of reference. But in terms of how Minnesota stacks up against other states or stacks up against the U.S., the Twin Cities is a big driver of how Minnesota fares in those rankings. So, yeah, thank you for that question. Here, we can see that the percentage of Minnesotans experiencing food insecurity. Again, the most recent data that we have from the Household Pulse Survey, and a lot of this data, I think, is really more interesting for what it doesn't say, right? So early on in the slides, I showed you that, declining infections rate and, sort of the rationale for why Dr. Fauci, sort of said that, our country, for all practical purposes, is out of the pandemic phase. Yeah, there's, I think a fair bit of underreporting that's driving that decline too, right? And so as we've adapted and gotten more responsive testing at home and so forth, I think that their ability to track infections has also impacted the way that some of these trends look. And I think people experiencing food insecurity, this is another one of those, I think, tricky data points where if you're in a place where you're secure enough to respond to a household survey, then it's likely that population looks a little different than the population who might be experiencing food insecurity on a more regular basis. And so that's part of the reason that we wanted to invite Rebecca Mino into this conversation, because the Second Harvest Heartland has a really unique perspective and close-up view of this phenomenon, and might be able to get us a little bit closer to how these data are being used to help people as a result of the pandemic. And so, when we look at these measures, I mentioned earlier, we can break down trends and look at disparities by race. And, here again, just as we saw with, employment and with housing insecurity, communities of color in Minnesota seem to be experiencing this this food insecurity at higher rates. And as you can see, as of late, at least this data is indicating that gap is widening in a troubling way. So, with that, I would like to go ahead and transition. If we don't, are there any other questions?
No questions in the chat right now.
Yeah, thank you all so much for listening so intently. Food insecurity, particularly measured from the Census Bureau's Household Pulse Survey, is most certainly a 300,000 foot view. And so we wanted to invite Rebecca to come give us a perspective from a direct service organization that is in this space and may be able to add some texture to the data that we have on campus. So with that, go ahead and take it away. Thank you.
Thanks, Justin. Happy to be here. For those of you who aren't familiar with Second Harvest, I want to just spend Second Harvest Heartland. I want to spend just a minute there because to understand kind of the context for what I'm going to talk about today. So we are a food bank that covers an area of 59 counties in central and southwestern Minnesota and in western Wisconsin. So as a food bank, what we do is we source and distribute food to local organizations throughout those counties, like food shelves and meal programs. And then they're the ones in those cases that are actually directly serving people who need food support. So we're kind of the behind the scenes partners to all of those people on the ground who are really getting the work done. So I think that's kind of helpful to understand how we may look at this data in a way different from other organizations. We do serve some people directly, and we'll talk about that too, but I think that's some helpful context. So if you want to just go ahead, so I'm going to spend a couple minutes with you all here. Like I said in the introduction, I get the awesome opportunity to work not only within our organization, but with our partners too. So I'm going to talk about I'm going to give a couple of examples about how we use data to help us think, to understand our own work and to share that information with those in the community. So our supporters, public officials, just the general population. I'm going to talk about how we use the information from those partners that I talked about, and then how we do some more direct planning based on data. So I've got a couple of examples that we'll work through. Feel free to put some questions in the chat, and we'll just get on going with our first example. Great. So the first example is really about how we use the data during COVID to understand the need for food support and how we talk about it. So Justin gave us some great information that kind of tells you what's going on, that has been going on in the world, and we've all experienced it, and Justin gave some great data. So we saw the unemployment figures, we saw some of the ways that families were struggling, and in our work, how that really shows up is more people looking for support. So more people looking for support from those local organizations. So those partners really saw, in most cases, a lot of increased visits. And then that in turn comes back to us as an organization where we're seeing a lot of need and increased demand from our partners for food. So, and it was all changing so very rapidly, as you all probably experienced yourselves. So that's kind of where we were working. And if you go to, so what we're working to do, we use the data for a couple different purposes. We wanted to understand the need as it was changing so that we could meet that need. We needed to not only get the food in the door so we could get it back out the door, but we needed the financial resources to do that because we were working, much above normal operations. And then it was really important that we were sharing the story of kind of this evolving need across the community. So we leveraged, as you can see, I just put a handful of them on here. We have leveraged a lot of different data sources. The graph on the left is showing from this is pretty early in the pandemic, showing the number of pounds of food that we delivered. So you can see after March, kind of in line between 2019 and 2020 in March, and then March hits and it really, there's a big gap or a big increase, in 2020. And that increase really did continue. So this was some of the data we used, is our internal data about the amount of pounds of food we were getting out the door. We also looked at the data that our partners share with us every month. They report on how many people they're serving, how many visits. And so we were getting that data on a regular basis, so we could look at that information to really help us understand demand as well. We also had some other internal data that we used from our SNAP team. And then to get a kind of a bigger picture idea outside of our organization, we were looking at some external data sources. So Feeding America, which is the national umbrella network of food banks, does some really great research, and they were producing estimates on food security food insecurity that we were leveraging pretty heavily. And they used some of the Pulse data, some other federal data sources for that purpose. And then we were also looking at that Pulse survey data that Justin was showing earlier. And one thing I want to point out about this, and I think this is something that we struggled with trying to think through at the very beginning, and can be confusing. The Pulse survey actually is measuring food sufficiency, which is a different measure from food insecurity. And I think often those two kind of get interchanged when they're actually something different. The food insecurity rates are actually quite a bit higher than the food insufficiency rates. So that was helpful context for us, and something that we were trying to make sure that others understood, is that food sufficiency is actually a kind of a more severe measure. So these were all data sources that we were kind of looking at and reevaluating on a regular basis to kind of understand the story. And one of the things that we did with that data is we produced our COVID dashboard. You can see it here. This one is from March of 2021. We started doing these pretty early in the pandemic. We updated these monthly and posted it on our website and shared it externally. It was a really helpful tool internally to kind of keep track of everything that was going on, because things were moving so very quickly. But it was also really useful to help tell the story externally with the media, with the general community, with supporters, to really show, you can see with the SNAP referrals on the bottom left, you can see we're comparing it to a pre-COVID timeframe. You can see that 60% increase of visits, or, for this month, since the start of the pandemic, there was a 58% increase of visits for food shelves. So this was a really powerful tool that we use both internally and externally. And one of the ways we used that was to talk to media, to talk to reporters, and try and get this information shared, this data, along with stories about people that were coming to get services, why they were coming, kind of how this was working, as well as the stories of, how these distributions of food had changed over time because of COVID, because of the restrictions and how we were to interact. And through kind of all of this data sharing, quantitative and qualitative, we were able to get quite a bit of media attention around the issue. which was important for a lot of ways. First, we wanted people to know that, hey, this is a problem and we need to do something about it. We also wanted to help kind of normalize the fact that a lot of people are in this situation right now. A lot of people are needing help. Many people who haven't had to ask for help before, and to make it okay for people to ask for that help. It also kind of spreading this message really widely also helped gain new donors for our work, which was crucial, especially as we were trying to meet that increased demand and the increased food costs that came with the pandemic that we're all still kind of dealing with. So this kind of grouping of data that we use were really powerful, both internally and externally, for this sharing of this message. The next example is a bit more concrete and more about how we made specific decisions about program. And this example is all about how we were helping to make sure kids had food during the pandemic. So if you have kids, and probably if you don't, you have kids somewhere in your life. In March of 2020, schools shut down. First, I thought it was going to be temporary. Turns out it wasn't. So schools were scrambling to try and figure out, how do we make sure that kids still have food, even if they're not coming into our building. That's a huge effort in and of itself. But on top of that, they were also trying to plan for their summer food service program. I'm going to call it SFSP. It's a federal program that helps provide meals for students in the summertime. Normally, school districts would be planning right around this kind of February, March timeframe. They'd be planning for their summer. Now they're trying to plan for their summer and the rest of the school year. And on top of that, if that wasn't enough, the federal rules around this program, SFSP, because it's a federal program, there was a lot of things that were changing, and the rules were changing to try and make it easier, which is great. But it also made the goalposts keep moving for the school districts who were planning for this. So they were kind of trying to deal with all of this at the same time. So not enough time to be a school food professional. So our goal really was, we wanted to use data in the best way that we could to work with those school nutrition folks to figure out, where are there going to be meals? Where are we maybe anticipating that the meal service is not going to be as easily accessible as normal, so that we could provide targeted support to those school districts and make sure that they can do the best they possibly can under these circumstances to get as many kids fed as they could. And we also felt that this was a good opportunity to kind of make known the issue of what was going on, because of all of these competing priorities with sponsors, the policymakers, the people that were making decisions about this program in real time. So we leveraged a lot of data from the Minnesota Department of Education. We started with their school enrollment data, and then we also used data that lays out where all of the sites for the SFSP program. So an SFSP site is the actual physical location where a kid or a family would go and get food. So that's what I mean when I say an SFSP site. So we got the data on where the sites were in 2019, also from the Department of Education. And those two pieces of data are actually, you can just download them right from the website. So it's a great source of data, pretty specific, but a good source of publicly available data. We also got the 2019 numbers about how many meals were served, where, what type of meals. And that is also publicly available data through the Department of Education, but that is not just accessible on the website. You have to request to put in a data request for that. So we kind of used all of this 2019 data as our baseline. And then we also used geospatial data. So one of the things you'll see here in a second is we made some heat maps to kind of visualize where these meals were going to be available. And if you are a mapper or you're interested in mapping and you haven't been to the Minnesota Geospatial Commons, I highly recommend it. It is a fabulous resource, really well organized. I think it's really super easy to use. So great if you're a mapper and interested in that. I would definitely check that out. And then in addition to the secondary data, we did some primary data collection. We did an online survey of school districts, specifically the nutrition professionals, to get a sense of what their plans were for the coming summer, so the summer of 2020. We asked about what kind of meal sites they were planning, how much reach they thought they would have, and how they would distribute meals. This kind of last piece on how you would distribute meals is really important, because normally there's really only one way you distribute meals. You distribute meals, the kids eat them on site, and that's that, because that's the rule. But since the rules were changing, they had different options for how they could distribute meals, which means they could get more meals out to a kid at a single time. And that was kind of a game changer for their ability to feed kids. So that was an important question to ask about on this survey. So we did some widespread sharing of the survey. We did some targeted outreach with specific school districts. And then when we got results in for any of the school districts we had data for, we kind of did several comparisons and analysis. We looked at comparing what we were estimating for the summer of 2020 compared to what we had happened in 2019. It gives us an idea of a baseline. We also looked at it compared to school meals, because school meals have much better coverage in terms of getting kids fed than the summer meal program does. And then we also just wanted to look at, like, how many meals are we actually getting to students? So that's what this next map is going to show. This is one of the heat maps that we made. So this particular heat map shows how many meals that we were estimating in these school districts were going to be projected for how many meals per week per student who was on free and reduced lunch. So we had specific reasons for choosing free and reduced students, so we can talk about that if people are interested. But we really wanted to give a picture. We know that kids need 21 meals a week if we're thinking 3 meals a day, 7 days a week. And so this really shows pretty clearly where we were getting pretty close to that, with some of those districts up in 17 meals a week, and other places where we're talking about less than half a meal per week. So this gave us a really good visual about, like, okay, where's coverage we think and we're estimating is going to be pretty good based on current plans at that time, and where is there going to be a really challenge for some families to access meals. We also did some heat mapping that showed specific locations of the sites themselves, so that we could see within a school district where is access going to be better than others. So you can go ahead to the next slide. So what did we do with this information? So it was really helpful. We really could get a sense of, like, where is working pretty well and where do we think we can do better. Our child hunger team this is one of their main things, is how do we get those federally funded meals to families, to students. So they did a lot of extra support and technical assistance in areas where we felt like the coverage was not going to be as good. We always do we do grants to help support the summer food service program and their sponsors. So we did a lot of targeted outreach in those areas where the coverage didn't look like it was going to be as good, so that those sponsors knew, okay, hey, there's funds available that we can use and get and leverage to try and, hire more staff or whatever it was they needed to do to get more meals in those areas. And then we also did a pretty extensive marketing campaign more broadly, and help provide support to partners to do the same, so that families, where there were sites and sites were available, that we could make sure families knew about them and could use them. So those were just a couple of the ways that we kind of use that data and that map to make some really targeted decisions about where can we have the biggest impact with the resources that we have available. So hopefully some useful examples, and happy to answer questions that people have.
No questions in chat right now, but if anybody wants to speak to you right now, would be a good time.
Rebecca, thank you so much for those deeply insightful examples. I think that it's really, really excellent work that you're doing, that Second Harvest Heartland is doing. And we so much appreciate you sort of shining the light on some of the important work that you're doing. So thank you. Now we want to hear from you all. We're so excited that you all were able to join us today, but I think that we should maybe look to going into a breakout, and then we can really talk a little bit about, reflecting on some of the things that you may have heard or learned today, other things that you might want to share. Were there any aha moments that you had when you were looking at the data? And then talk a little bit about how do you use data in your work? What public data sets do you use now? And what data do you need that you wish you had that isn't out there? I think that this breakout session will be a great opportunity to exchange some ideas from across sectors. And you never know, the question that you came in today with may be answered in the breakout.
Justin, before we move into breakout, there is a question in the chat, and maybe we can just pause for a couple minutes to see if there are any other questions before we move in. The question in the chat is, do we have any data on single mothers?
Data on single mothers? Well, there is some data on the Household Pulse survey that's broken out by household type. I am not altogether certain whether they break out the gender of the householder, but I do know that single parents are represented in some of that data. And so, you can go to our website and certainly find that in some of the COVID sections. But yeah, that great question. And I think the short answer is yes. Other questions that came up while either I was presenting or while Rebecca was presenting those examples before we go into the breakout?
Yeah, there's a question for Rebecca from Melissa. She asks, are school summer meal programs returning to the model of meals needed to be consumed on site?
Yeah, thanks for that question, Melissa. It's a good one. And the answer is nobody knows. So our policy specialist would tell you that there is still conversations happening at the national level. As of this minute, the waivers that allowed for meals to be served, consumed off of site, which is what has happened in the past 2 summers, those are set to expire, but there is some serious negotiations about extending those again for this summer. So the answer is nobody knows until the legislators make up their mind. And it's a little hard because they're kind of back essentially into that same situation they were that first year. Is they're trying to plan, but the goalposts for what they're planning for keep moving. So it makes it really challenging.
There's another question from Amanda. Rebecca, can you review the difference between food insecurity and sufficiency again?
Yeah, so I'll hit the highlights. And if you want to talk more offline, certainly welcome to. I mean, one of the biggest difference is the time frame. So the food insecurity measure, which is kind of what we were all used to prior to the pandemic, the USDA's way of measuring it, is a more extensive measure in terms of the questions that they ask. And it's based on a 12-month time frame. So families are asking if these kind of challenges they've had getting food, when have they happened and have they happened in the last 12 months? The food insufficiency questions are asking about the last 7 days. So you're getting a kind of a much shorter time frame in terms of the answers. And then the food insufficiency questions are limited. I think there's 2 of them. So they're only asking about two very specific ways that people can't access or having challenges accessing food. Whereas the food insecurity questions, there's quite a few more. And so they're asking about kind of a larger variety of ways that people might be challenged to get food. And some of those are, as I kind of said, like less severe, more like, are you stressed about being able to source food, as opposed to like, and I don't have the exact wording in front of me, but as opposed to, were you not able to get enough food? So hopefully that answers your question, Amanda.
Thank you. You've definitely given me a lot to think about. We're tracking that measure. And after having heard from you, I think that we probably have it mislabeled, and I think we should probably change it. What do you think? So with that, if we don't have any other questions out there, I definitely want to give us all a chance to interact, because there's so many of us with so much experience from so many different places. And so with that, we will go to our breakouts and see you back shortly. Welcome back. Welcome back. So glad you all were able to share some of your thoughts, knowledge, experience, ideas, questions. So as we're all sort of reconvening, I'd like to, actually hear from you. What were some of the key takeaways in your conversations? What public data sets do you use? We definitely want to hear about those, and any other questions you have for Rebecca and myself. And so with that, I will stop sharing my screen, and feel free to just unmute and share with us what you had going on in your group.
I can kick it off. Our group was just happy to kind of meet with each other and hear about some of the, I guess, what we got out of the statistics that we were just seeing. Also keeping in mind that, when you get new data, you want to process it for a minute before you're able to give real input on it. We had conversations about, housing stability, about education. It was just a lot of kind of exchange of information, and I couldn't really speak to specific insights because I didn't write them down, but but it was a good exchange. Anyone else from my group want to say anything?
Hi, Amanda. I'm at PPL. This is a really great session. It's been really nice to kind of dig into the data and see both Justin and Rebecca what you've brought forward. Some things that we were talking about is there's a lot of data to digest, and then also thinking about things that we're missing, or like I've personally had a hard time finding, are in the realm of equitable development or equitable housing development, as well as maybe, I know that we actually did research project with Wilder to find out that 24-month housing stability is kind of our gold star for. We know that negative reasons for move out drop a lot there. So there aren't a lot of like industry standards in a lot of our lines of business. And so using the DEED website and Minnesota Compass has been really helpful for us as we do that work. Something that we've been thinking a lot about at PPL is community safety. That's something that is taking up a lot of our mind as well as our participants' minds in community. And then I'd also be interested to see more mental health data and how that, like in different breakouts, because that's also something that, you know, you hear a lot of the news and I've seen in my life and things where we were at these tipping points before the pandemic, and now we're here, just how that's played out specifically in Minnesota. But again, yeah, I'm excited to dive in a little bit more.
This is your time. Who else?
I have another just question. Sorry if I'll take the silence as a jump in. Can you, I think that I understood it, but I just really want to make sure I understood it. So the pulse survey data, that was all what were your slides, right, Justin? Or did your data come from something else?
My data came from a number of places, but the data that I presented on you about conditions here just in early April is from the U.S. Census Bureau's household pulse survey. So that's for those of you who haven't heard of it, it's an experimental data collection effort that they designed specifically for COVID. And they release data on about a monthly basis. And so I was able to just update those yesterday with the latest release. So it's current as of the 11th of this month.
Okay. And then, so for the pulse data, that is particularly hard because we know maybe highly mobile families were not going to get that information. The other data sources you were using, that's not the same case. We feel like all of those groups are included in that data.
So the demographic and economic data that I provided are from different sources that I think speak to, sort of more for overall conditions, if that answers your question. Other takeaways, aha moments, data sources that you'd like to share with us?
Justin, somebody asked if it's possible to share the link on the chat, and I could share our COVID data page link with them, which does include the household pulse information that you gave. And if there's a specific one that you would rather they go to, just let me know.
Who else wants to jump in and help us debrief? Melissa.
Yes, I was just going to. I just have a quick question because I have got booted due to a network upgrade. So I missed most of the first half, unfortunately. So I'm just wondering if if you guys plan to send out a recording for us.
Yes, this session will be recorded and will be available for anyone who didn't get to participate in all. So
I saw it was recording. I just wasn't sure if that was for you or for us.
Yeah, we'll make it available to you.
Great. be awesome.
Anything come out of your breakout discussion that you'd like to share?
We just noticed it was a kind of a contrast between the two of us. I'm in Bloomington with one of the largest food banks in the state. And my roomie was from a very small rural public health thing. So just kind of the contrast of the volume of the work we're doing and in the different areas. You know, she sounded like she was deep in the deep dive of all the COVID data, and I was in the deep dive of all of the social services help that we offered, food assistance. So it takes all kinds.
Great. Thanks for sharing. I wonder if your partner here wants to share with us the community that they're from and what they've seen and heard and experienced.
Hi. So I'm Andrea, and yes, I'm in Cook County, Minnesota. So this is a small community. We're preparing this year to develop our new community health assessment, and I'm supporting on that work. So I joined this webinar to learn a little bit more what public data that is available out there and what is being used, and how can we maybe use some of those sources for our small community, that the ones that are up north like probably have similar scenarios that we do, but you know, we deal with different challenges in a big city. So yeah, like Amanda was kind of saying that what needs attention these days is like mental health, and that's where we're targeting our adolescents' mental health, and how maybe these have increased that and creating network support. We saw the CDC report on adolescents' mental health that came recently, and that was like one of like the documents that we're using to target our work for this the next few years. So and I'm very involved with the COVID response and the recovery response. So yeah, that's what I was able to share with her. So, and I'm sharing with all of you.
Thank you for joining us. Thank you for sharing a little bit about what's going on in Cook County. We really appreciate it. Anyone else have anything that they'd like to share before we wrap things up? I'm going to very quickly sort of go back to my screen and say, you know, we're all adjusting to a new normal, doing things in new ways, thinking about, you know, how we're going to be on the other end of this. And, you know, as I was planning this, I was wondering, you know, what tense am I going to use when I talk about the COVID pandemic? Will I safely be able to talk about it in the past tense? And so I don't know. It's sort of in the middle here right now, but I'm hoping one day in the future we can do a solid retrospective and talk about this as though it were history. But for now, I very much want to thank all of you for joining us today and for sharing your experience and your knowledge and perspectives. And thank you so much to our sponsor, Blue Cross Blue Shield of Minnesota, Boston Scientific, Close the Gap, Best Buy Ecolab. Your support has been very, very important. So thank you all so much for joining us today. I hope you have a great afternoon. Please connect with us. Visit mncompass.org. Feel free to reach out to me via email if I can do anything to assist you, and have a great week and a great weekend. Goodbye, everyone. Thank you.
Thank you.